Your precious newborn is finally here. But wait, is that noise they're making normal? Is that rash something to be worried about? And why do they want to eat every single hour? Newborns do some weird things that can be alarming to new parents. What's normal and what's not? Today I'll discuss common odd things that newborns do that you may not have expected and why they happen. Make sure you stick around to hear when it's important to seek care from your child's clinician. I'm Dr. Mona, a pediatrician and mom. I help empower parents with easy to understand, evidence-based information so you can make the best choices for your child. Make sure to like this video and subscribe here to Peds Doc Talk TV to stay up to date on the latest videos and new content. Let's first talk about some common things I see with a newborn skin. Many babies develop baby acne during the first 6 weeks of life. This rash is usually on the cheeks and nose and looks like teenage acne with little raised red bumps. It's best to not do anything with it. Don't pop it, don't touch it, as it will go away on its own, and some products may irritate the skin. A popular ointment that has come highly recommended by my community at Peds Doc Talk is Tubby Todd All Over Healing Ointment. I support it, but make sure to patch test an area of the skin before putting it all over their face or where you see acne. If their acne is very severe or lasts beyond 2 months of age, speak to your child's clinician because sometimes they'll recommend topical ointments to prevent scarring. Many babies also develop cradle cap, or greasy scales on their scalp or eyebrows. The scales can also appear like yellow crusting. It's thought to be caused by maternal hormones. It does go away on its own, but you can also apply coconut oil on the scalp and use a soft brush to soften the scales and comb it out if desired. Newborn skin commonly peels within the first weeks of life. This is because they were sitting in amniotic fluid for 9 months and they come out dry. Imagine if you took a bath and didn't moisturize, you'd come out dry too. You don't need to do anything for it. The peeling will resolve on its own. It's not itchy or bothersome to your baby. But if it's cosmetically bothersome to you, you can use non-fragrance baby lotion or ointment. But just like snake skin, the dry, flaky skin will peel off, leaving that smooth baby skin without you doing anything. Looking for more about newborn rashes, make sure to watch this other video on my YouTube channel. Breastfed babies and formula-fed babies cluster feed. A common feeding concern is the fluctuations in the feeding patterns of newborns. Why aren't they on a schedule? It's common for babies to cluster feed or feed more frequently than they normally do when babies are trying to build up, for example, their mom's milk supply if breastfeeding. And formula-fed babies can do this too when they're going through growth spurts. Follow your baby's lead and offer feeds when feeding cues are noted. Cluster feeding is typically short-lived and your feeding rhythm should return back to a normal rhythm eventually. If you're concerned that your baby isn't gaining weight or making wet diapers, speak to your child's clinician. Newborns also have jerky movements. When startled, they will jerk their arms upward. When sleeping, they will jerk, very quick, sometimes waking themselves up. Those movements are normal and due to a developing neuromuscular system. If you notice rhythmic jerking, with eye rolling or jerking that cannot be stopped when you apply pressure to the extremity, versus stop. Speak to your child's clinician so we can evaluate. Parents are also often concerned when they notice their baby's hands and feet appearing blue. This is called acrocyanosis and is common due to the normal limited blood flow to the area initially after birth. This is usually noted within a few hours after birth and resolves as the newborn gets older. This self-resolves and is nothing to be concerned about. You do not need to put gloves on their hand or socks on their hand unless they feel cold to you. If there is blueness on their face or chest, please let your clinician know. Parents also often report that their newborn is noisier than they anticipated. Babies make so many odd sounds. They hiccup often. Mothers may even have felt these hiccups while the baby was in their belly. Hiccups should not be bothersome to your baby, and you don't need to try any interventions to stop them. Don't give them water, don't scare them, nothing. They will go away on their own. The same goes for sneezing. Sneezing in newborns does not mean they are sick or have allergies per se. Babies born via C-sections often sneeze a little more frequently than their vaginal counterparts because they didn't have the pressure of the vaginal canal to squeeze out fluid when they were delivered. But whether born by C-section or vaginal delivery, no intervention is needed for sneezing unless they seem congested and super bothered, in which case you can use nasal saline and suction that out, or if they are acting ill, not feeding well, or have a fever over 100.4 Fahrenheit, let your clinician know. Newborns also make a lot of noise in their sleep. They will grunt, whimper, cough, and sneeze while they are asleep. And sometimes they'll sound like a truck rolling through. That's totally normal. If the baby is awake and in distress, meaning you can see their ribs pulling in, they're breathing faster than normal, or you notice any color change, bring them into their clinician for evaluation. Otherwise, keep them in a safe sleep space, and there's no need to watch them while they sleep or worry about these noises. As they get older, those noises usually go away. I describe it as the newborn baby having a very lax airway, almost like a drunk adult, and you can hear them be very noisy when they sleep. Another common breathing concern that parents have is when a baby breathes really fast and then takes a second or two to take their next breath. This is called periodic breathing and is very common. Let me demonstrate again. A more advanced and rhythmic breathing pattern will come. No intervention is needed unless your baby's breathing is constantly fast with any color change or ribs retracting quickly in and out. Then speak to your child's clinician. Let's talk about a few common things we see in newborn eyes. It may be unnerving as a parent to see your baby's eyes going in every direction or appearing cross-eyed, but it's actually really common. The muscles controlling the movement of their eyes are still strengthening. And also, babies have a very flat nasal bridge, so they can appear cross-eyed when they're actually not, called pseudostrabismus. This should be resolved by 6 months of age. If it persists past this point, or if your baby is not tracking objects by 2 months of age, or you feel like one eye is doing it more severely than another, let your clinician know. You may also notice discharge coming from your baby's eyes. This is likely caused by a blocked tear duct, which can affect one eye or both. This should spontaneously resolve by 1 year of age. You can wipe away the mucus with a wet washcloth, or you can massage the inner eye with your clean finger or a Q-tip. If you notice redness in or around the eye, or it doesn't resolve by 1 year of age, talk with your child's clinician. Last but not least, let's talk about some common things that we can see with baby boys or girls' breasts or genitalia. Some babies have breast buds or little lumps under their nipples. This also is normal, and both boys and girls can be affected. It does not mean they're going through puberty. This is believed to be due to the exposure to mom's hormones while in utero. This will resolve with time without intervention. Don't touch it, don't pinch it or squeeze it, as you wouldn't like that either, and it can bother them. Some parents will see a little blood noted in their newborn girl's diaper, or a small amount of blood when they wipe. Vaginal bleeding can happen after birth, and also it's thought to be from maternal hormones, mimicking almost a mini period. It's also common to see some vaginal discharge. Both are normal and will resolve with time. Don't panic, but you know it happens, and just wipe front to back. For boys, it's common for their testicles to appear larger than you may expect. This is typically due to a hydrocele, or excessive fluid in the scrotum surrounding the testicle. Your child's clinician may shine a light on the outside of the testicle to confirm the diagnosis. If the testicle illuminates, it's a hydrocele. It is painless and harmless and usually goes away on its own by 1 year of age. If the testicles appear red or blue, let your clinician know. So there you have it. Newborns like to keep us on our toes for so many reasons, including the things that I mentioned. But I hope this video helped you learn about common things that we see in newborns that may at first appear alarming, but are actually totally normal and expected to resolve with time. If you want this information as a free downloadable PDF, make sure to grab it here. Did your newborn experience any of these things? Did you learn anything new from this video? What other things are your newborns doing that you want to know is normal or not? Leave any comments or questions below. If you found this information helpful, please do me a favor and like and share this video, and make sure to subscribe to be the first to know about new videos published, because this is how this channel continues to grow. And if you'd like more information on baby's first year of life, check out my New Mom Survival Guide, an on-demand digital course with printables, video tutorials, and so much more to help you take the guesswork and stress out of raising your new baby. I'll see you all next time for another video here on Peds Doc Talk TV. Stay well.